is a graph of voltage versus time of the electrical activity of the heart using electrodes placed on the skin. Do you have a trouble in reading ECG? This is the simplest way. Let me show you. What is normal adult heart rate? Normal heart rate 60 to 100 beats per minute. Tachycardia, heart rate greater than 100 beats per minute. Bradycardia, heart rate less than 60 beats per minute. Calculate heart rate using ECG. If a patient has a regular heart rhythm, their heart rate can be calculated using the following method. Count the number of large squares present within 1 RR interval. Divide 300 by this number to calculate heart rate. As an example, if the number of large squares is 4, 300 should be divided by 4. It equals 75. Heart rate of that patient is 75 beats per minute. If a patient's heart rhythm is irregular, the first method of heart rate calculation doesn't work, as the RR interval differs significantly throughout the ECG. As a result, you need to apply a different method. Count the number of QRS complexes on the rhythm strip. Each rhythm strip is typically 10 seconds long. Multiply the number of QRS complexes by 6, giving you the average number of complexes in 1 minute. As an example, the number of QRS complexes in an irregular ECG for 10 seconds equals 10. 10 multiplied by 6 equals 60. The patient's irregular heart rate is 60 beats per minute. First-degree heart block, AV block. First-degree heart block involves a fixed prolonged PR interval, greater than 200 milliseconds. This is a condition in which the wiring of the heart is slow to send electrical signals, but all of the signals are able to pass successfully. There is no electrical block, but rather a slowing or delay of the signal. It usually does not cause problems. Second-degree AV block, type 1, is also known as Mobit's type 1 AV block or Wencker-Bach phenomenon. This is specifically characterized by an increasing delay of AV nodal conduction until a P wave fails to conduct through the AV node. This is seen as progressive PR interval prolongation with each beat until a P wave is not conducted. There is an irregular RR interval present. Second-degree heart block, type 2. Second-degree AV block, type 2, is also known as Mobit's type 2 AV block. Typical ECG findings in Mobit's type 2 AV block include a consistent PR interval duration with intermittently dropped QRS complexes due to a failure of conduction. The intermittent dropping of the QRS complexes typically follows a repeating cycle of every third, 3 to 1 block, or fourth, 4 to 1 block, P wave. Third-degree heart block or complete heart block. Third-degree or complete heart block, CHB, is an abnormal heart rhythm resulting from a defect in the cardiac conduction system in which there is no conduction through the atrioventricular node, leading to complete dissociation of the atria and ventricles. The ventricular escape mechanism can occur anywhere from the atrioventricular node to the bundle branch Purkinje system. Third-degree AV block is electrocardiographically characterized by regular PP interval, regular RR interval, more P waves are present than QRS complexes, lack of an apparent relationship between the P waves and QRS complexes. The delta wave. Delta wave is a slurred upstroke in the QRS complex often associated with a short PR interval. It is most commonly associated with pre-excitation syndromes such as Wolff-Parkinson-White syndrome, WPW. The characteristic ECG findings in the Wolff-Parkinson-White syndrome are short PR interval, less than 120 milliseconds. ST elevation. The ST segment represents the interval between ventricular depolarization and repolarization. ST elevation is most commonly caused by acute full-thickness myocardial infarction. ST depression. ST depression occurs when the J-point is displaced below baseline. Just like ST elevation, not all ST depression represents myocardial ischemia or an emergent condition. There are multiple conditions associated with ST depression. The main cause is myocardial ischemia. Other possible causes are hyperkalemia and medications such as digitalis. T waves. T waves are considered tall if they are greater than 5 mm in the limb leads and greater than 10 mm in the chest leads, the same criteria as small QRS complexes. Tall T waves can be associated with hyperkalemia, tall tented T waves, hyperacute ST elevated myocardial infarction. Biphasic T waves. Biphasic T waves have two peaks and can be indicative of ischemia and hyperkalemia. Flattened T waves. Flattened T waves are a non-specific sign that may represent ischemia or electrolyte imbalance. For watching, subscribe now to stay with us, and stay safe.